We're at Mayo Clinic, and we pay for the subscription to this giant database of all the supplements in the world. And even this is kind of coming up with like a, meh, you could try it. This is On Nutrition, a podcast from Mayo Clinic where we dig into the latest nutrition trends and research to help you understand what's health and what's hype. I'm Tara Schmidt, a registered dietitian with Mayo Clinic in Rochester, Minnesota. This episode, Integrative Nutrition. Conventional medicine does a lot for us. We can get surgeries to fix major issues and pharmaceutical drugs to treat complex conditions. But your health isn't just whether or not there's something majorly wrong with you. There are tons of little lifestyle habits and choices that add up to create the big picture of our wellness. For example, do you take a daily multivitamin? Or are there certain foods that help you feel well or consistently make you feel unwell? And that's where we get into integrative medicine, and specifically, integrative nutrition. So how do we figure out those practices that keep us feeling good? And when should you reach for a supplement instead of a head of broccoli? To guide us through the ever-evolving world of integrative nutrition, Dr. Brent Bauer is joining us for this episode. He's a doctor of internal medicine and the director of the Mayo Clinic Complementary and Integrative Medicine Program. He researches and evaluates integrative medicine therapies so patients can get the best that conventional and complementary medicine have to offer. Hi, Dr. Bauer. Thank you so much for hanging out with me today.
My pleasure.
Before we get into the nitty-gritty of your field as it relates to nutrition, I would like you to share what you believe are the differences between complementary medicine, integrative health. I think this is a little controversial, but maybe alternative medicine. But for those who are unfamiliar, can we get your take on those three different terms?
Yeah. So let's go back 30 years. You would have most likely heard alternative, unorthodox.
Oh.
Those were the terms the medical community applied to the things patients were increasingly doing. Acupuncture, yoga, maybe some herbs. And so that was kind of a pejorative term. And then we started figuring out, no, some of the things patients were doing weren't replacing medicine, it's complementary. So we had for a while complementary and alternative medicine, or CAM. And then finally, we as physicians learned that there's enough research to suggest that many of these things can be actually beneficial if you bring them together. So what we have at Mayo is what's called an integrative medicine program. And that's part of a larger group called Integrative Medicine and Health. But really the integrative part of this is we do a lot of research so we can answer the questions when our patients come to us and say, can I do acupuncture before surgery? Should I use this herb to help my arthritis? So we can give them not only a summation of the data that's out there, but also how does it actually work here at Mayo?
And I think a lot of that has to do with bioindividuality, this idea that we're all biologically unique, right? Can you tell us more about what that means and how it can be applied to what you do and within someone's diet as well?
If we had 100 patients in front of us, we gave them all, let's just pick an herb, they were all going to take ginseng, we would have probably 100 different responses, right? So even though we know many patients find ginseng helpful for dealing with cancer-related fatigue, that's a couple trials we've done here at Mayo. We use that for those patients, not in isolation, but in conjunction with their good nutrition, exercise, and so forth. So we have to recognize that we're all kind of weird, and we're all weird in a good way, but it just means we can't say this is truth and everybody must follow just the Mediterranean diet, or everybody must just eat this many carbs or this. So there's a lot of individuality that we always don't get a chance to explore fully in conventional medicine.
And when you say that, I feel like the biggest barrier we in the medical community have is time.
Absolutely.
You've got a 15-minute consult. I had a 45-minute consult. I thought that was pretty wonderful. But we're just, unfortunately, time restricted, and that can sometimes lead to less personalized care. But we do the best, of course, prior to the visit, during, after, to learn about our patients and see what we can use our time for.
I think that's the biggest complaint when, I see patients from all over the country, all over the world. If they're coming from around America, 99% of them will say, gee, I don't get this much time with my doctor back home. And I'm very quick to point out, that doesn't mean they're bad doctors. It just means that our system has developed in such a way that we reward doing things to patients. So procedures and surgery generally pretty well compensated. Sitting down and having that conversation that can teach them a whole new way of eating, a whole new way of thinking or exercising that can actually have lifelong benefits. Those generally are very hard to bill for at a way that can compete with the procedure. So we become a very procedure-oriented, to a large extent, medical system. And I think that's to the detriment of our patients.
Sometimes even dietitians seeing someone for a specific disease state isn't covered. And it just makes me cringe because I feel like there could be so much more than medication or a surgery or a procedure that could be done with just
and
eating.
there should be, right? Because I mean, can you imagine if every patient had an invested, knowledgeable dietitian as part of their annual care? And what if they also had a coach? And what if they also had a physical fit? You know, what if we really approached people as the complex human beings that they are, and then we could really individualize to that patient in front of us the best ability, the nutrition, the extra. I mean, it really is kind of what I think medicine once was striving to be.
Sure.
And then we kind of got side railed with third-party payers and Medicare and this and that. But I think underneath it all, I think we still all want to do the best for our patients.
And what resources do we have outside of coming into the office, right? So not everyone, even though they probably should have a psychologist of some sort. So if you can't show up at a psychologist's office, is there an app? Is there a Facebook group even, right? We have to be a little bit weary of everything that comes with the internet. But generally speaking, there's other options. And those I feel like are expanding.
And that's, I think, again, where integrative medicine has a nice foothold.
Yeah.
Because I can look at different biofeedback devices. We use some in our executive health program that use the brain waves, your EEG, to help you understand what stress is, what stress isn't, and how to biofeedback your way into training the brain, which I could do with yoga or Tai Chi or meditation, but I don't have time, even in the time I have, to teach all of those things. But I can give people an app that they can work on and at least get started. So the toolkit is much broader today. And again, I think patients are more savvy in some regards and they have more access generally. And I think that's ultimately the most important thing out of this, is that really the most important person for our health is us.
And what does health mean from an integrative medicine perspective? Obviously, I'm going to say with my dietitian hat on that food is a big part of health. But what else is there?
If we're talking about health, food is part of how we get optimal health. So is exercise. So is sleep. So is our social connectedness. So is our spirituality. And so is our connection to nature. So when I think of health, I think those are the 7 main areas we have to be engaged in actively thinking about and really thinking of those 7 pillars. How do I each day honor my nutrition? Where's my spiritual practice today? How am I going to connect to nature today?
And advocate.
And advocate is absolutely right. I think we have to ask for more from our healthcare system as individuals because we're not getting what we should necessarily right now.
I agree. For patients that you see, tell me about access. So is this a popular path for patients? Is it limited access? Is it more of kind of a fringe choice for some people who are interested in that style of medicine?
My patient population is everybody at Mayo Clinic. So if you go into our ordering system and you're going to order an EKG or order a potassium level, you can also order an acupuncture treatment. You can order massage. You can order an herb consult. So it's integrated. You know, integrative medicine is integrated at Mayo Clinic. Now, does that mean every physician, every nurse, every practitioner here thinks of that every time they have a patient in front of them? Of course, the answer is no. But patients who say, you know, I'd really like to explore the role of supplements, or I'd really like to explore whether acupuncture could help me, most of the time that will lead the clinician of whatever stripe they might be to go to the web or to the ordering system, and they can put that in and be seen by not just me, but lots of other folks here.
I've used that order before, and especially for patients who are on a long, long list of supplements.
Yes.
And I assessed their diet as best as I could, especially related to the nutrients and the evidence in those supplements. But dang, those lists are pretty long. And so I put in an order to say, you're going to sit down with someone who's probably going to red pen a lot of these and say, you might not need this. This would be a better choice. Or you're getting plenty of this in your diet. Hopefully they read my note. Maybe not. But we feel very fortunate that we have this gigantic team. And of course, not all health systems have that.
And we are blessed because not only do we have really good nutrition folks, We've also got a lot of pharmacists who actually make this kind of an area of expertise so that they can look at somebody who's on a complicated medical regimen, heart transplant patient, very important drugs. If we mess them up because of the wrong herb, we're all unhappy. So we have a lot of expertise, but to your point, that's not always available in the community.
Yeah.
Sometimes you just have to ask, and there often is somebody within a health system that has some knowledge. And if not, a lot of this does become personal work.
Sure.
And it's harder. But again, I think it's very important that we don't get into well, it's natural, so therefore it's safe, so I can take these 20 herbs and not think about it.
Yeah. Integrative medicine encompasses a lot of practices, treatments, and therapies that might not be considered capital M medicine, but can complement conventional medicine and support overall health. And when we talk about health, we don't just mean, are you sick? It's nutrition, exercise, sleep, social connectedness, spirituality, and connection to nature. The best way to fulfill those areas is different for everyone because we are bio-individuals or biologically unique. For example, eating raw garlic might be one person's helpful health practice and another person's digestive nightmare. Integrative medicine and more personalized, holistic care can help just about everyone. Just imagine if you could talk about food with me or your favorite dietitian of choice once a month, regardless of a diagnosis. Sounds pretty great, right? And speaking of dietetics, let's go deeper into the nutrition part of integrative medicine. So in your work, what do you tell people can truly be improved by diet? Do you consider any disease state or diagnosis or condition can be at least improved by diet? Are there some that you focus on the most?
I see patients. I just saw a nice young lady who has a new diagnosis of a cancer. And I see people who are here because they're execs and I want to keep my brain strong for the next 20 years. So I see the spectrum from what I would consider healthy, but room for improvement, all the way to people who are struggling with life-threatening illness. I think every one of them can and should be informed about what nutrition can help with, what to avoid, what we might want to overemphasize because of a specific need. So really, I don't think there's anybody who wouldn't benefit from thinking about an integrative approach to their nutrition.
And I think there's a few specific diagnoses that we don't always associate with nutrition. So we know that if you have high blood pressure, you would benefit from a DASH diet or a low sodium diet. If you are worried about heart health, then you should consider Mediterranean. Yep, we kind of know those, and I think the world knows that. But what about conditions like chronic pain, inflammation, gut health? They're not new, but newer topics that everyone's talking about.
I think we're attuned to those things better than we were 25 years ago. Certainly, when you think of inflammation, that can have a huge contribution from diet, both plus and minus, right? So we think of the processed foods, we think of the artificial sugars, we think of regular sugar as kind of inflammatory things. So those are things when I see a patient who has autoimmune disease, inflammation, joints that are hot and inflamed, that approach is not going to be just diet, but part of the approach will be, let's look at what you're eating that's increasing inflammation, and then what might you want to emphasize to help decrease inflammation. That might be more fatty fish, getting the omega-3s, that might be getting some turmeric, as opposed to maybe taking the curcumin supplement. Maybe we can cook with more turmeric.
Please, yes.
So lots of opportunities to think about things like that. Gut health, we know so much more now about probiotics, and yet we're really just scratching the surface.
Yeah.
But eating the foods that are good sources of probiotics, the fermented foods, obviously yogurt's been around for a long time. So I think a lot of the chronic problems, diet's always going to be part of what we should focus on and try and optimize.
And like you said, there's both sides to it. There are foods or patterns of eating that can cause or worsen a condition. And there are, of course, foods that may put you at decreased risk or lessen your symptoms, et cetera. And a lot of them are also, though, if I can say, individualized, right? So for someone who knows that gluten is inflammatory for them, that's true. And I believe them. I'd like them to experiment and not just make that assumption based on Google. But people can look me in the eye and say, yeah, I don't feel well. I don't respond well. It doesn't work for me. Then I don't want the rest of the population to assume that eating whole wheat bread is a bad thing, because there's a lot of people who would benefit from eating whole wheat bread instead of the other types of starches that they're eating. So it can be different for 2 people, right? Or 100 people, like you said.
So I think you're making a good case for bio-individuality that we talked about before.
Yeah.
And so I deal with this on a fairly regular basis. People come in and they've been tested and they don't have the biomarkers that suggest that they're gluten sensitive or that they have gluten sensitivity. And yet when they go off gluten for a month, they feel better, their joints are better. So then I don't really worry too much what the blood test says. I worry what the patient says.
Yeah.
And so I think that's the idea of, as an individual, I should always kind of think of myself as an experimenter with a group of 1. So if I think gluten might not be good for me, right where you're at today, my joints are swollen, my gut's not good, I feel yucky. Okay, then go off gluten for a month and then reassess those things. And now you get a much better idea of whether you truly are, whether you're allergic to or sensitive to or just don't do well with. But you're right. You can't just hear it on the news, gluten's bad, and then change your diet, because you may be missing elements that are actually very beneficial for you. So if you're going to change something, do it with a rational approach and really think of yourself as an experimenter.
And one variable at a time, right? You can't take out lactose and fructose and gluten and then reintroduce them all back in and know what the culprit is. So
You've learned nothing, right? But now we're also Americans, and Americans generally don't want to take time. We want an answer today. You really have to take time for each of those eliminations and then reassess before you can make an informed decision about, I will not eat this for the rest of my life. Those are big decisions. They shouldn't be made casually or just because you heard, something on the internet.
And sometimes I feel like people take what I would believe is the harder route, more difficult route of, I'm just going to eliminate all 3 versus taking weeks, honestly, to eliminate and then reintroduce and then wait, right? But we do like things quite immediate here, I think.
But you know what? I find a lot of people who do that, when you go to that restrictive diet, one of the things you're certainly getting rid of is a lot of processed food.
Exactly. I agree with that completely.
So at some point, you're going to recognize that for a lot of people, it wasn't really the gluten elimination. It was the elimination of the high sugar stuff, the stuff with lots of processing, the dyes, all that stuff, the artificial sugars. You get rid of that stuff when you go to restrictive. I think that's where a lot of people feel great if they've gotten to a point where now they're focusing on whole foods and they're eating more fruits and vegetables because they can't eat the junky stuff. You can go around the house twice. As long as you come in the front door, we're all happy.
We all know that we can't really go wrong with fruits and veggies. But are there other specific foods or nutrients that can improve some medical conditions?
I think we alluded to it a little bit. If you have heart disease, you're probably going to want to include more fatty fish. You're probably going to want the oats, soluble fibers, beans, and so forth. So I think each individual disease probably has some element of that. But I also don't think that there's a one size fits all. So everybody who has heart disease should eat beans, right? I mean, that's a good place to start exploring. But how do we actually personalize that or get back to that individuality? There is, I think, where you want your team, preferably somebody with nutrition information, your primary care team, bring all that together.
So back to kind of an integrative approach to nutrition, what do you expect is first before you treat someone in this way? So do you expect that they have tried all of the integrative options before we go to medication? They've tried all medication options and now we can go to more integrative things. Does it all get married together at once?
I think when you think of integrative medicine, it's really not different than just really good medicine, right? At the end of the day, what we're talking about is honoring your spirituality, that's kind of what medicine is or should be. Well, I think the same thing with integrative nutrition. We're not talking about something really bizarre, far out there. It's really just, I think, emphasizing that more holistic approach, which opens up the door, right? So maybe if I'm wearing my conventional hat, it's going to be, let's talk about the Mediterranean diet. Let's focus on that. If I wear my integrative medicine hat and I hear you saying, I can't eat that way, maybe we do talk about the keto diet. Maybe we do talk about intermittent fasting. So we start to open up the opportunities, and that gets back to what works for you as an individual, not what do I think is the right approach. So that's where I think we start to have fun with this concept of integrative nutrition. It's that there is bio-individuality. I like that term. And to recognize that, I'll give you some great thoughts. I may be right, I may be wrong, but you'll tell me in a month when you say, I tried it your way. Here's what I found. This was negative. Great. We've learned something. You don't respond to whatever we tried. We'll try something different.
And so you're not necessarily arguing against conventional medicine. This is not just for patients who don't want to take a prescription. Okay, you don't want to take a prescription, you're going to take a supplement. This is part of it. It's all rolled into one.
Again, much of what we're talking about from a nutrition standpoint isn't really that funky. It's not really that different. It's just that I think we get a little more time to think about it if we sit down and say, let's call this integrative nutrition. Well, that then helps me think a little more broadly. Like, I've got to think about the person. Where do they live? What is the food availability? What are their limitations? What's their spirituality? Maybe there's something in their religious background that restricts certain foods. And so now we get a little more chance to bring the whole person into the discussion of what are we going to do to optimize that individual's nutrition.
What I'm picturing is with more integrative medicine and nutrition, you're saying, okay, this is part of the protocol, or this is what the guidelines say, but let's also work on the outside of that as well and add some more, subtract some more, whatever is appropriate.
Yep, absolutely.
Just about everyone can benefit from integrative nutrition, with the right expectations. It's highly unlikely that how you eat will cure or treat a serious medical condition, but knowing what foods can do things like reduce inflammation versus aggravate it can be an important part of your overall treatment plan. And your most important data set is how you feel as a unique individual. What foods make you feel energized and full? Which ones make you feel sluggish or bloated? Your answer will be different from the next person's, and that's expected. Last but not least, if you want to test how you react to foods by eliminating them from your diet, have patience. If you take out 3 potential food types at once and feel better, you won't know which one was the culprit. So start slow and take your time to eliminate and reintroduce before making big decisions about what to stop eating forever. Now we're going to talk about a big topic, supplements. What you should be getting from food, what you should be adding in, and all the gray areas in between. You might enjoy this topic more than I do because I just feel like it's so overwhelming. But let's talk about supplements. Let's talk about vitamins and enzymes and minerals. What I'm hearing is Mayo Clinic is studying them. You are looking at the research, but you're listening to the values and the preferences of your patients. It doesn't sound like there's necessarily a protocol of we're adding supplements. Where do those fit in integrative medicine?
The supplements are kind of like phase 2. Phase 1 is build the foundation. Where I would start with the patient in front of me is always first, what's your nutrition? What's your exercise? What's your mind, body? What's your sleep? What's your spiritual? What are we doing? That's the foundation. And if you start with, I think I'm going to take this supplement to make this thing better, and you haven't built the foundation, I think that's a disservice. So people often come with their 30 or 40 supplements, and their question is, what are the next 5 I should add? And I used to kind of maybe yell at them a little bit, like, that's not very smart. And then I got a little smarter and realized, you know what? That's a marker for somebody who's actually trying to be healthy. So when I do an herbal consult, usually 80% of the time is spent back over on, let's build that foundation. Now, if you've got a great foundation and then you still have vitamin B12 deficiency, of course you're going to take vitamin B12. Maybe once you've built the foundation, you say, my arthritis is still really bad. Have you tried glucosamine and chondroitin? Or if you have an inflammatory arthritis, have we tried curcumin? So now we start to target our use of supplements. Where's the evidence that a certain supplement would fit for you as an individual, as opposed to, I saw something on TV last night, I should start taking that. And then again, I always try it as an experiment. If I think you could be benefited by glucosamine for your joints, I have them rate all their joints. Like, oh, my knees are 8 out of 10 pain. And then write it down and then take the glucosamine for 3 months. Now re-rate all those same joints. And if you see, gee, my knees were 8 out of 10, now they're 3 out of 10, it's not proof that the glucosamine did that, but it's a pretty good indication that you're getting benefit. We might do some blood tests to make sure there's not any idiosyncratic or weird reaction. But that's a good way to say, okay, for you, you do respond to glucosamine. We don't see any negative effects. So that becomes part of your integrative approach. It's not replacing good nutrition. It's not replacing weight loss. It's not replacing physical therapy, but it's an evidence-based adjunct applied to you as an individual.
You are your own guinea pig. And when we say the word supplement, I like to remind people, like, think about that word. You shouldn't just jump to taking calcium. You can take calcium, if necessary, to supplement your diet because you don't have enough calcium in your diet. And that's okay. But I likely do like an actual math equation to see how far away you are before I say, okay, I understand you don't do any form of dairy. And I get that that's a heck of a lot of broccoli to get down. Okay, maybe. But also, please talk to a medical provider so that they can look at your other medication lists, your medical history, et cetera.
Yep.
I really actually like pulling up one of the databases that we use and saying, okay, these are the 10 studies that have been done on this supplement. Most of them say limited evidence to support X, Y, and Z. And I actually feel like that's a good education experience for the patients to say, I don't even know, right? We're at Mayo Clinic and we pay for the subscription to this giant database of all the supplements in the world. And even this is kind of coming up with like a, meh, you could try it.
Yeah. But I think you're hitting one of the challenges, right? Because most of the supplements are not things that can be patented. Mm-hmm. Whereas if we have a new drug, there's probably a drug company that's invested hundreds of millions of dollars.
Yeah.
And so they will pay for a huge trial.
Thousands of people.
Many of the trials we've done with supplements, we're happy if we get 100 or 200 patients. They can still teach us something, but they're not going to be definitive, right? So you can't say, well, we did a study of 200 patients and always everybody will exactly get this result. We really need thousands and thousands of patients. So we're really going to get that. And until we do, we have to recognize the limitations of the knowledge in front of us. And that's why I think individualizing, not every patient gets that response. And maybe a vanishingly small number get adverse events that I've never heard of before. So that's why I approach everything as, just like with a new medication, I give you a new pill for your blood pressure. You get a cough. Well, that's probably an ACE inhibitor effect. I'm going to put you on a non-ACE inhibitor so we can get the benefits without getting the side effects. We should approach the supplements the same way.
How often do you see supplements, let's say, backfire, right? So we know we have this excellent vitamin E example from a while back. Mm-hmm. Do you still see that type of thing happen where the supplement has absolutely no positive effect, only negative, or supplements that we thought were going to be beneficial but actually did the opposite?
Yeah. I don't know if it's a supplement per se, but coffee enemas. We're in the news for quite a while. We still have a few patients going to Mexico for those. And we've seen some patients actually get in real serious trouble with electrolyte imbalances. Mm-hmm. So there's always going to be those things out there that people are going to try and do. There's also things that probably, if used correctly, were okay. But then we take and say, well, gee, if 2's good, 50 must be better. And so we've seen liver transplants as a result of, well, remember when ephedra was very big. Ephedra is a little herb that's actually not bad for weight loss if used very carefully and very appropriately with supervision. But we're Americans. We want to lose weight. They say take 2, but I'm going to take 20. And all of a sudden we had people get liver damage. St. John's wort, very popular for depression, actually works fairly well for mild depression in some cases, but it's got a real predilection for changing metabolism of a lot of other drugs. So women on oral contraceptives, not pregnant, take the St. John's wort, they get pregnant because the oral contraceptive has been rendered so low it's not effective. So I think there is that element that we have to kind of push back a little bit. It's a natural thing. It's from nature. Therefore, it's safer than a pharmaceutical drug. Sometimes that's true. Sometimes it's not. And that's where we have to have that stop, learn, talk to your primary care team, talk to a professional who's got extra information before you just bring things on board.
I actually fell into a rabbit hole fairly recently from Instagram, and it was talking about a nutrition kind of supplement, and I just wanted to learn more, and all of the reviews were just raving, and everyone's life changed, blah, blah, blah. And then I come to find it's a multi-level marketing.
Yeah.
Right? But not everyone's going to have a realization or take the time to really dig that far to say, oh, maybe this was fabulous for lots and lots of people, and I'm happy for you. But there's also a high chance that it's not.
Yeah. And sometimes the things that are out there are actually things we should know about or should be doing.
Yes.
So I think of vitamin D, right? 20 years ago, vitamin D was big in the, quote, alternative, end quote, world. And generally conventional medicine, we weren't too excited about it. And then we started seeing some studies where vitamin D deficiency could actually impact your immune function, could obviously impact the bone function, might impact the brain. So all of a sudden we went from something that was out there So now it's one of the more commonly ordered tests at Mayo Clinic. And again, the pendulum's kind of gone the other way. It went from we don't think about it to maybe we are taking too much of it.
Yeah, we're over supplementing.
But again, this is where if I know there's no benefit to taking extra, don't do that. If I'm deficient, get it to the normal level. But again, I think we learn sometimes from the things that are maybe a little fringe appearing. And I've tried to not immediately say, oh, that could never be true. I always try and step back and say, have they figured out something that we as conventional physicians have not? And then half the time it's a money-making scheme and it's good to shut it down and go away from it. But every once in a while, that's where we learn something like, I never would have thought of that before.
I'll say to patients a lot that research is always moving. So there may have been some mistakes that we've made in the past because we didn't have enough information. We, being on the more conventional, kind of conservative side of medicine, may not have yet accepted something that we absolutely will scream from the rooftops in 10 years. But it's complicated. And you're welcome to do your own research. If I or Mayo or the Academy of Nutrition doesn't, quote, recommend something, you are still welcome to do your research, and I'll probably do a little bit too, and hopefully we can come up with a good answer.
I think anybody that thinks medicine is infallible hasn't talked to me enough, because I started medical school at Mayo Clinic 40 years ago. And I can tell you a lot of things that were taught kind of like, this is gospel, this is how we do things. We no longer do that. And I don't think that's a reflection on, boy, they were stupid back then, or boy, what it is we learn.
I think in the years of my career, I've become a little bit more neutral to hearing about integrative medicine, because at first I felt like it was a little bit black and white, and that's what I was taught to do and to practice, and evidence-based. And as time has gone on, I have felt myself just being more open, because I'm not going to argue with how someone feels. So especially in this world of nutrition and supplements specifically, I will just kind of use a scale and say, okay, is this harmful? Sometimes they are. Is this neutral? Is this helpful? Where's the risk in it? There's always going to be some risk. So you have to just kind of weigh that out.
Well, and I think there's a nice little grid, right? I mean, the 4 squares, what works and what's safe, we should use it. What works but has risks, we might use it, but we got to really think. What doesn't work but is safe, that might be an individual choice. And what doesn't work and what isn't safe, we have to say no.
I explained that so much better than I did. Thank you.
But that's kind of the thought process, right? If there's evidence and it's relatively safe, if it's improving our care, what we offer to our patients or what we do for ourselves, we can endorse that. If there's risk, but there's still benefit, that's an individual choice. We have to think more. If it's not helping, but it's not dangerous, I don't have to fight with my patient. If they want to use homeopathy when they get the sniffles, that's how I fight my colds. I know that there's really not much risk with it. There may not be strong evidence that it works, but that's a much better conversation than I have the sniffles, I want an antibiotic. And then there's things that are definitely harmful and don't have any evidence to work. And those are ones we have to, from a conventional standpoint, say, no, we think that's wrong and not to do it because there's risk and there's not enough benefit.
When we talk about experimenting essentially with our own health and with these pillars, et cetera, how does someone know if the approach is working for them? Is this, like you said, kind of on a scale of 1 to 10? Is there an improvement or is there a positive change? Is that as easy as it is?
The question goes back to the individual. So whatever your interest is, whatever you might be reaching to the shelf or clicking on whatever website you order your things through, ask yourself, why would I want that? Well, I want to take X because I heard on the radio that it will lower my cholesterol. I want that because it's supposed to help my joints. I want that because it's supposed to improve my sleep. Okay, let's look at the information. Is it plausible? Is there any existing evidence to say it might work? Is there any evidence about its safety? If we get, well, it looks pretty safe. There's something intriguing here. It might work. Now your homework is get your baseline. I'm going to take this because I think it'll improve my sleep. Well, what's wrong with my sleep? It takes me 2 hours to fall asleep. I wake up 6 times. I wake up unrefreshed. Oh, okay, that's my baseline sleep. Take it for a month. Take it for 6 weeks. How's my sleep? And then look back at those same outcomes and just measure. And if it hasn't changed at all, doesn't mean it's a bad supplement. It just means individually it's not working for you. And then we make a little note. I always try and get people to write down, I tried melatonin, I do not respond, so that 2 years from now we don't say, oh, well, why don't we try melatonin? Sure. So I think the idea of recording what works and also what doesn't work, then we can say, okay, well, if that didn't work, what's the next thing we should try?
You talk about the other 6 pillars, though, would you prefer that they work on their stress management first? And are they exercising? And are they having caffeine too close to when they're going to bed? So the question would be, do they adapt things with the other 6 pillars before we do the experiment with the supplement?
So, I mean, sleep is such a common problem. Conventional hat, we always talk about, are you drinking caffeine too late in the day? What's your amount of aerobic exercise? Are you using a device before bed? Let's first of all get rid of all those, take an hour before bed, get an old-fashioned book, soft light, read the book, maybe do meditation or something. So we're preparing the brain to get natural melatonin, to get natural sleep cycles. And I really try and get people to do a really aggressive sleep hygiene for about 3 months. And then if they say, look, I did all that, I'm sleeping a little better, but I'm still having struggles. Now we have an opportunity to say, maybe this is where we'd explore melatonin or theanine or valerian, some people seem to benefit from. But again, now we're going to do the experiment. Keep the foundation. We don't get rid of the foundation. But on top of that, we add in melatonin. But again, we rate before and after.
I completely agree. We also know that with some of these supplements, you can buy these super large doses, way more than you'd get from eating food. And that reminds me of what happened with vitamin E a while back. What can we learn from these cautionary tales?
We know vitamin E is important. We need vitamin E. It's not a bad vitamin, but somewhere along the line, maybe 20 years ago, we got the idea that, well, if a little's good, a lot's got to be better. People who have diets that are rich in vitamin E seem to have lower heart disease. We simplistically said, it must be the vitamin E. Let's take a lot of vitamin E and we'll really push that heart disease down. And actually what turned out is heart disease went up in a lot of those studies where people were taking extra vitamin E. And I think it's the same trouble with, take your pick, beta carotene, antioxidants. When we eat the foods, we generally get these really cool things that happen, but we're Americans, and Americans say, well, I could change my entire diet and eat these really healthy foods, or I'll just take super doses and I'll get the same benefits. And unfortunately, it almost never works. And in some cases, like vitamin E, it actually led to bad things. Before I take a supplement, I really try and get patients to optimize what they're getting in their diet. Can we get enough vitamin C in our diet without having to take vitamin C? Most of us can. Can we get enough vitamin D when we're older? Sometimes no. So if you're low, I'm going to have you take a vitamin D supplement, but I'm going to do it at a range that brings us into a normal level, not super high.
And you can't get the amounts of these nutrients in excess in your diet in most cases, right? Like if you eat that many carrots, like you will actually start to turn orange, like your hands, you will be orange. And people don't eat that many carrots. I would actually love them if they started eating that many carrots. So there's just such a difference between the amount that you would generally consume via diet and then the amount that's in these supplements.
The perfect example is water, right? We can die if we drink too much water. We can dilute our electrolytes and we can die. So there is no such thing as a safe. This is all, everything. It really comes down to dose and how you use it. But it's pretty hard for most of us to get into trouble. Like I'm getting too many antioxidants because I ate, 14 pounds of grapes. I guess you could try and do it that way, but you're going to get stopped, right? We're going to get full. I'm sick of grapes. So it's pretty hard to get in trouble from a food standpoint, but it's relatively easy to get into trouble when we start indiscriminately, not with guidance, not with good science, not with an evidence-based approach, but indiscriminately. Oh, I heard this is good. I'll take 5, I'll take 10. I'll do it at super high doses. So again, there's no free lunch. Let's be really thoughtful about all 7 domains of how we optimize our health, and then let's do it right.
It has to be hard sometimes, right? The easy thing would just be to go to your local pharmacy or drugstore and grab it off the shelf and take it. And that's 0.1 seconds out of your day. But sorry, that's not how
if I find that
works.
you won't be talking to me again because I'll be so rich. I'll be on my island somewhere with
That's what I said about weight loss, Dr. Bauer. Yes. I haven't found the secret yet, you guys. I will not be here if I do. Thank you so much for all of your time today. Dr. Bauer, you are an absolute wealth of knowledge, and we're so happy that you agreed to come on.
I appreciate it very much. I hope everybody does a great job with those 7 domains.
So if you're considering dietary supplements, remember, there's no magic pill to get you out of healthy habits. Before and even while taking supplements, it's important to have a solid foundation of a healthy lifestyle. That includes eating a balanced diet and giving yourself a chance to get nutrients from food rather than relying on a capsule or powder. If you do decide to take a supplement, do your research and involve your care team. Sometimes our current research won't be able to predict if something can help you, but we can decide if there's minimal risk and if it's worth a shot. It's ultimately your decision, but you should walk into that decision being informed while still being open-minded. Once you've done your research, you should also record your baseline. How can you measure how you feel now so you'll notice changes? That way, weeks later, it'll be easier to tell if a supplement is doing what you'd hoped. And don't forget to keep your care team informed of your supplement choices and progress as well. We want to know. That's all for this episode. But if you've got a question or topic suggestion, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. For more On Nutrition episodes and resources, check us out online at mayoclinic.org/onnutrition. And if you found the show helpful, please subscribe and make sure to rate and review us on your podcast app. It really helps others find our show. Thanks for listening, and until next time, eat well and be well.